So next class of anti-HIV drugs are HIV protease inhibitors. HIV protease inhibitors. Example: indinavir, lopinavir, saquinavir, ritonavir. So all are this group inhibit the reversibly HIV protease enzyme. Okay, so the name itself indicate that mechanism. Okay, so they mainly inhibit the protease enzyme, HIV specific protease enzyme. So this enzyme is responsible for the cleavage of viral polyprotein into number of essential enzymes and structural proteins. Essential enzymes means reverse transcriptase, protease integrate, and several structural proteins. Example: glycoprotein, nucleocapsid, and matrix proteins. Okay, so these are all the essential enzymes and the structural proteins are required for the maturation of the viron. Okay, maturation of the, so the inhibition of this enzyme prevent the maturation of the virus particle and results in production of, okay, non-infectious viron. Okay, so spreading of infection from one T lymphocyte to other T lymphocyte is going to be inhibited by HIV protease inhibitor. So they are mainly make the virus into non-infectious, okay, viruses. So these are the mechanism of action of HIV protease. Okay, HIV protease, HIV protease. So these are the some characteristics of pharmacokinetic. They are poor oral bioavailability. Okay, they have protease inhibitors have poor oral bioavailability. The bioavailability is going to be increased by taking with high fat meal. Okay, high fat meal. But whereas bioavailability in Dinavir is uh, decreased decrease and others are essentially unaffected. Okay, so high fat meal increase the rate of bioavailability of nelfinavir and sequinavir. So whereas bioavailability of indinavir is going to be decreased by high fat meal. Don't take high fat meal with indinavir. So but others are essentially unaffected. Okay, remaining protease inhibitors are unaffected by this high fat meal. Okay, next, very important, all are substrate of CYP 450 3A4 isoenzyme. Okay, so that most of the are enzyme inhibitors. Okay, lastly, non-nucleoside reverse transcriptase, some are enzyme inhibitors, some are enzyme inducers, but majority of the protease inhibitors are, okay, CYP450 enzyme inhibitors, so that they cause so many drug interactions with other drugs. Okay, side effects. Major side effects are metabological side effects. Okay, CNS paresthesia, taste disturbances, sleep disturbances, GIT, nausea, vomiting, abdominal pain, diarrhea. Metabolic is so many metabolic side effects are there. Hyperglycemia, hypertriglyceridemia, increase in triglycerides level, increase in cholesterol level, hypercholesterolemia, hyperglycemia. Okay, so redistribution of fat, it leads to buffalo hem. Okay, breast enlargement. So these are the other side effects of the protease inhibitors. Okay, next is drug interactions. Okay, so drug interactions, generally if you use protease inhibitors with other drugs, they inhibit the metabolism of other drugs, so which causes increase the plasma concentration, which leads to side effects. Okay, already, so here I am stressing some other some drugs which have the uh, drug interaction with ritonavir. Okay, statins, it causes rhabdomyolysis. Midazolam, triazolam, excessive, okay, sleeping, sedation. Fentanyl, it is a opioid analgesic, respiratory depressions. Okay, warfarin, so it causes bleeding. Okay, sildenafil, excessive vasodilation, it causes severe hypotension. Phenytoin toxicity. Okay, so along with this, okay, not only have the disadvantages drug interactions, it is also have the advantages drug interaction, in the sense this ritonavir, okay, it is a most potent protease inhibitors among the sorry, ritonavir is the most potent CYP450 enzyme inhibition activity among protease inhibitors. So that ritonavir is no longer used as a single protease inhibitor, generally is combined with other protease inhibitors, okay, in order to increase the pharmacological activities of other protease inhibitors. So that's why ritonavir is considered as a pharmacokinetic booster or booster of other protease inhibitors. Okay, so if ritonavir is combined with other HIV protease enzyme inhibitors, okay, their plasma concentration is increases because their metabolism is stopped by ritonavir, so that okay, whatever the other protease inhibitors, whenever you need to take along with ritonavir, their doses also going to be reduced. Okay, why you have to reduce the dose? Okay, so if even though you reduce the dose, they produce same therapeutic activity, same therapeutic plasma concentration. So because because of the ritonavir is going to be stop the metabolism of the drug, so that they attain the therapeutic concentration in the blood. So this is about the protease inhibitors. Okay, so now you completed about anti-HIV drugs. Okay, majorly for exam point of view, please consider on, okay, reverse transcriptase and protease enzyme inhibitors. Okay, so next class of drugs are anti-herpes drugs. Okay, anti-herpes drugs. Okay, so herpes viral infections. So herpes viral infections are DNA viruses. Okay, HIV virus is a RNA virus. Herpes viral infection is a DNA virus. So these are the three main. Herpes virus infection is mainly caused by three types of virus. One is herpes simplex virus. Okay, herpes simplex virus, it causes infection to the genital organs. Okay, infection to the genital organ, it is called as a herpes genitalia. If suppose herpes infection is causes infection to the mouth and lips, they are called herpes labialis. Okay, suppose if the herpes infection causes infection to the eye, it is called herpes keratoconjunctivitis. If it is causes brain damage, infection to the brain, that is called hepatic encephalitis. Encephalitis. Next herpes infection is caused by one more virus, Varicella zoster virus. Okay, it causes chickenpox in children. It causes shingles in elders. Okay, now cytomegalovirus. Cytomegalovirus, it causes retinitis, means it is related to eye, esophagus, okay, inflammation of the esophagus, and colitis, inflammation of the colon. Generally, cytomegalovirus, it is seen in immunocompromised patient. Generally, whatever the herpes infection, generally seen in the immunocompromised patient. Okay, so drugs which are used for the treatment of, so if you see, a majority of the herpes infections are related to topical. Okay, like genital organs, it is expressed it is expressed on the topically. Okay, so you may definitely seen the, okay, topical infections. Okay, you generally may seen that there is a bubbles arises in the skin with filled with some fluid, so that whatever the drugs which are used for the treatment of herpes, there may be some anti-herpes drugs or herpes drugs are applied topically. Topically in the sense, in the form of either, if suppose if the infection to the eye means, you have to use eye drops, or if it is skin means, you have to apply any powder ointments form. Okay, suppose if it is also taken by systemic routes. Okay, so anti-herpes drugs are taken by either systemically in the form of tablets or in the form of injections, or also they are in the form taken in the form of topical formulations. Okay, so classification. So majorly this all anti-herpes drugs are classified into two types. One is nucleoside analogs. Second one is pyrophosphate analogs. Okay, so nucleoside analog already we know the how nucleoside reverse transcriptase are working. Same mechanism. Same mechanism is happen with in case of nucleoside drugs which are used for the herpes viral infections. Okay, so nucleoside analogs and, okay, pyrophosphate analog. Okay, pyrophosphate analog, only one drug, that is called as a foscarnet. Nucleoside analogs are end with this aciclovir, ganciclovir, penciclovir. Okay, so these are the nucleoside analogs. Okay, so I will take the mechanism of aciclovir as a prototype, so that you write down the mechanism of action. If you understand the aciclovir mechanism, the remaining drugs have the same mechanism. So most of the nucleoside analogs are contain naturally occurring purine and pyrimidine nitrogen bases. They couple to unequal carbohydrate. Okay, so what is nucleoside? Nucleoside in the called nitrogen base and sugar. Okay, so majority of the nucleoside analogs which are used for herpes virus infections. Okay, so they are the analogs of naturally occurring pyrimidine nitrogen base, they contain unnatural carbohydrate, unnatural unique. So generally how the sugar is present in the nitrogen base, see here is, so this is guanosine. Okay, guanosine is nothing but is a nucleoside. Okay, it is made up of nitrogen base, purine, and as well as sugar. Okay, sugar. So but this aciclovir, so aciclovir is look like a guanosine. Okay, aciclovir is look like a guanosine. What is the difference between guanosine and aciclovir? Our drug, so our drug is a nucleoside analog. Okay, guanosine is a nucleoside, so our drugs is also look like a natural occurring nucleosides. Okay, our drugs, aciclovir is a similarly structurally similar as that of guanosine. What is guanosine? Guanosine is a naturally occurring nucleoside, but our drug is, okay, synthetic nucleoside analog. Okay, right. So what is the main difference is it consists of acyclic sugar. That's why it's called as aciclovir. Acyclic means it does not contain cyclic sugar. Okay, aciclovir. Aciclovir does not contain cyclic sugar. So this is the only difference between the guanosine and our this thing. Okay, then so what happened? Okay, so generally what happened in case of guanosine means, so if guanosine is there, it is a natural nucleoside, it is undergo a process like this. So guanosine convert into guanosine monophosphate. Guanosine monophosphate in the presence of our host cell kinases. What is meant by kinase? Kinase just will add the phosphate group, okay, to the substrates. Okay, guanosine monophosphate, guanosine diphosphate, guanosine triphosphate. Okay, so ultimately it is converted into nucleotide. Which nucleotide it is? Deoxyguanosine triphosphate. Deoxy sugar containing guanosine triphosphate. This nucleotide is going to be incorporated into the, okay, newly formed DNA. Okay, newly formed DNA in the presence of DNA polymerase. Okay, ultimately the DNA polymerase is responsible for, okay, complementary attachment of the nucleotides, okay, present on the DNA templates. Okay, right. So this same, your drug also undergoes same, like, so aciclovir monophosphate. Okay, so actually guanosine to guanosine monophosphate, guanosine diphosphate, guanosine triphosphate occur by our host cellular enzymes. But aciclovir, first step, what is the first step? Aciclovir to aciclovir monophosphate, it is happen only in the presence of virus infected cells, but not in other cells. Okay, so aciclovir is a prodrug. Aciclovir is a prodrug. So all nucleoside anti-herpes drugs are, okay, prodrugs. They are not an active form. They need to be converted into active form only after phosphorylation step. So aciclovir converted to aciclovir monophosphate only virus infected cell only. It is not converted. It is not able to. It is stay as such in the other uninfected host cells. It is only converted into active form only virus infected cells, because so first step of phosphorylation happen in the presence of viral specific kinase. Okay, viral specific kinase means, okay, herpes viral herpes virus containing kinases. Later on, subsequent phosphorylation, aciclovir monophosphate to aciclovir diphosphate. Okay, so aciclovir triphosphate is going to be occurred by host cell kinases. Okay, monophosphate to diphosphate, aciclovir monophosphate, aciclovir diphosphate, sorry, aciclovir monophosphate to diphosphate, diphosphate to triphosphate happen in the presence of host cell kinases. So ultimately aciclovir is converted into aciclovir, okay, aciclovir triphosphate. Okay, aciclovir triphosphate. Okay, aciclovir. So this aciclovir triphosphate, it is look like our natural nucleotide. What is the natural nucleotide? Deoxyguanosine triphosphate. So our drug is aciclovir, okay, aciclovir triphosphate. So these two are compete with, okay, viral DNA polymerase. Okay, viral DNA polymerase. So they are competitive inhibitors of viral DNA polymerase. So our nucleoside analogs of the anti-herpes drugs are, okay, they are DNA polymerase enzyme inhibitors. Okay, Here it is not a reverse transcriptase, just it is a simple DNA polymerase, same like reverse transcriptase inhibitors. Okay, ultimately what happened, DNA polymerase enzyme is going to be inhibited. Once DNA polymerase inhibited, so there is no further addition of nucleotides to the growing DNA is going to be stopped. So DNA replication is stopped. When DNA replication stopped, so the cell is unable to replicate it, so that you are going to be treat that infections. Okay, so again I will repeat you. Okay, aciclovir converted into aciclovir monophosphate in the presence of viral specific enzyme, later subsequent phosphorylation done by host cell kinase, lastly converted into active form, that is called as aciclovir triphosphate. This aciclovir triphosphate, it is structurally similar to the natural occurring nucleoside, that is nothing but deoxyguanosine triphosphate, so that it is competitively inhibit the enzyme, competitively inhibit the viral DNA polymerase enzyme, so which leads to there is a failure of DNA synthesis. Okay, failure of synthesis. So already this picture will the picture will give you the idea. So one this is DNA template. Okay, one side is one DNA template. So what is the DNA template containing nitrogen base is cysteine containing adenosine, guanosine, cytosine. So cytosine containing nucleotide is there. Okay, so complementary cytosine, guanosine is going to be added by DNA polymerase. Okay, now our aciclovir triphosphate, so already మీకు ఎలా చెప్పదలుచుకున్నా, how are going to be explained is either it inhibit the DNA polymerase or otherwise is going to be incorporated into the DNA structures. Okay, our drug itself, it is a okay incorporated into the viral DNA. See, it is here is binding with in place of G. Okay, our drug is going to be bind. Okay, because it consists all the things. Okay, except unnatural sugar. Okay, next. Okay, for example, okay, next T. Okay, complementary of nucleotide binding T is adenosine diphosphate. Once it is adenosine comes, it is binding to T, no problem, but there is a phosphodiesterase bond should be happen between the T nucleotide. That is going to be not happen because it does not contain any unnatural sugar, so it does not contain any hydroxyl group at third place. Okay, so because of this there is no formation of phosphodiesterase bond, so which this there is no continuation of the DNA. So aciclovir is going to work by two mechanisms. Either is going to be inhibit the viral DNA polymerase by competitively, or otherwise the aciclovir triphosphate is incorporated into the viral DNA. Okay, subsequent addition of nucleotides is going to be stopped because of does not contain because there is a failure of formation of the phosphodiesterase bond. Okay, right. So this is about mechanism of action of aciclovir. Okay, so aciclovir. So these are the some kinetics. Okay, aciclovir pharmacokinetics. Okay, I think you do understand the mechanism of action of aciclovir. Okay, next is pharmacokinetics. So already told you they are given by either oral route, IV route, topical route. Okay, so their metabolism in the liver and metabolism external through urine. Okay, the use. Okay, aciclovir, famciclovir, valaciclovir, penciclovir, they are mainly effective for herpes virus infection on versus zoster. They are not effective against cytomegalovirus. So aciclovir, famciclovir, valaciclovir, panciclovir is only effective for already herpes virus infections are 3. Okay, but these drugs are effective only herpes simplex virus infections, Bacillus zoster, but they are not effective against cytomegalovirus. Cidofovir, ganciclovir. Okay, so these are used for the treatment of cytomegalovirus. They are the nucleoside analogs used to prevent or treat the cytomegalovirus. Okay, side effects of the aciclovir. mainly headache. Okay, mainly headache, skin rashes, GI disturbances. Sometimes cause renal dysfunction and neurological toxicity. Neurological toxicity is expressed in the form of tremors, delirium, seizure, confusion. So major problem is neurological toxicity. Please remember, this acyclovir mainly cause neurological disorder. Example: headache, tremors, delirium, seizures, confusion. Next is skin rashes. Okay. Next class of antiherpes drugs are foscarnet. So foscarnet, it is not a purine and pyrimidine analog. It is not a look like a. So it is actually pyrophosphate derivatives. It is look like a pyrophosphate. It is an analog of the pyrophosphate. Okay, and also does not require any activation by the viral enzymes and host cellular enzyme. It is not required. Okay, so but how is going to be works? Again, it is a DNA polymerase inhibitor. Ultimately, you are going to be inhibit the DNA polymerase, which is essential for the replication of the DNA. Okay, so foscarnet, it is look like a pyrophosphate. So that so why I'm telling you pyrophosphate means this pyrophosphate. So for example, this DNA polymerase enzyme form phosphodiesterase bond between, okay, between incoming nucleotide and as well as the already incorporated nucleotide in the DNA strands. Okay, so how it is going to be happen means the phosphate, uh, actually any nucleotide is consist of triphosphate form. Okay, triphosphate form. The triphosphate form, uh, they bind to pyrophosphate binding site present in the DNA polymerase. With this, there is a formation of phosphodiesterase bond taken place by DNA polymerase enzyme. Okay, so the DNA polymerase enzyme make the phosphodiesterase bond between the two nucleotides. Okay, this is happened by binding of pyrophosphate, uh, phosphate. Okay, pyrophosphate of the nucleotide is going to bind with the DNA polymerase at pyrophosphate binding site. So our drug foscarnet, because it is similar to that of pyrophosphate, it is occupy the place present in the, okay, DNA polymerase. Okay, so that thereby our nucleotides, okay, whatever the nucleotides available in the triphosphate form, they are not going to be incorporated into the DNA structures. Okay, so I will tell you mechanism. It is act by blocking pyrophosphate binding sites present on the viral DNA polymerase. It blocking the pyrophosphate binding site present in the DNA polymerase, and thereby preventing the attachment of nucleotide precursor to DNA. See, so due to which what happened? There is a failure of attachment of nucleotide precursor DNA. So in order to continue the DNA synthesis, okay, so like this is going to be inhibit the DNA synthesis. Okay, so but uses, it is effective for all as herpes virus infection. It is effective for cytomegalovirus, varicella zoster, and herpes simplex virus. So it is given by IV because it is have poor oral bioavailability. It is given by route of administration is IV. Okay. So next mechanism, side effects. Major side effects are renal failure. Okay, renal failure. Major effects are renal failure, hematological deficiencies, arrhythmiasis, okay, heart failure, seizures, pancreatitis, okay, penile ulcerations. Okay, it is seen in males. Okay, penile ulcerations because high concentration of ionized drug in the urine. Okay, because high concentration of drug in the urine, so while passes through urethra, it will cause penile ulcerations. Okay, this is about the anti herpes viral infections drug. Only two drugs, two class of drugs: nucleoside analogs and pyrophosphate analogs. Okay, foscarnet. Okay, so next class, next topic is anti-influenza drugs.